Hello and welcome. On behalf of the Ontario Physiotherapy Association, I would like to welcome you all to part one of our two-part webinar series, AI and Physiotherapy in Ontario. My name is Emily Stevenson. I'm the Director of Practice and Policy for the OPA, and I will be moderating today's webinar. Now, we recognize that the conversation around AI is already well underway, and we know that you, as a physiotherapist or a health leader in Ontario, are inevitably asking questions about what this means for your practice or for your work. Some of you may be early adopters, and some of you may still be a bit hesitant. But no matter where you are on your journey with AI, we have really designed this webinar series with you in mind. And we, as the Professional Association for Physiotherapists in Ontario, are really committed to supporting you along this journey. Before we begin, I would like to acknowledge that the name Ontario comes from Indigenous Iroquoian languages, likely from the Huron word meaning Great Lake, or the Iroquois word meaning sparkling water. Ontario Physiotherapy Association acknowledges these lands as the original ancestral lands to many Indigenous communities, and we all continue to benefit from the cultural richness and the historic care and protection of the land. As an association representing members who contribute to the health and wellness of all people living in Ontario, it is vital that we also continue to contribute to the expansion of health justice. We support and advocate for all people to have access to culturally safe and respectful physiotherapy services. Now, before I introduce our speakers for today, we wanted to just really level set the conversation by reviewing a definition for artificial intelligence, which has been provided in one of the resources by the College of Physiotherapists. Artificial intelligence generally refers to computer systems that can perform tasks commonly associated with human intelligence, including learning, reasoning, decision-making, pattern recognition, and problem solving. So with this in mind, I would now like to extend a warm welcome to our esteemed group of presenters today. Charlotte Anderson, President of the Ontario Physiotherapy Association, will be sharing perspectives on the current digital landscape in Ontario. From the College of Physiotherapists, Craig Roxborough, Registrar and CEO, and Mary Catherine Fraser-Saxena, Practice Advisor, will provide the regulatory perspective on AI and discuss college resources available to you. And Anna Marie Sneeds, Senior Director, Clinical Impact and Performance with the Arthritis Society, will share valuable insights from their journey on implementing AI tools. Throughout the webinar, please feel free to type questions into the Q&A, and we will address as many as we can at the end. If you cannot currently see the Q&A icon on your toolbar, you can click the circle with the three dots, and then you will be able to select Q&A. And without further ado, I will pass things over to Charlotte Anderson.
Thank you, Emily. We are really excited to be here today having this conversation and to reflect the momentum that is building around AI in healthcare. It is important to recognize that the AI conversation is happening within a much broader digital health strategy, and it is critical that physiotherapists have a seat at that table as we continue to establish our roles as essential members of the healthcare system. And the response to this webinar tells us the profession is ready. With over 700 people registered today, that is a clear signal. The good news is we don't need to start from scratch. Many frameworks, tools, and lessons already exist from the experience of other healthcare providers and other physiotherapists who have begun integrating AI into practice. We have the opportunity to learn from what's already working and to step into this conversation with confidence. If we, as a profession, can prioritize participation in the digital landscape and thoughtfully optimize how we use AI, the benefits are going to flow to our patients, to the broader system, and to physiotherapists themselves. But let's start with a little bit of history from 3 months ago, but it's still history. That at the federal level, the government introduced Bill S5, the Connected Care Act, in February of 2026. The legislation would require all IT companies providing digital health services in Canada to adopt common standards for protected and secure information exchange across systems. This includes AI. The goal is straightforward: Canadians should feel confident that their medical records are secure, whether accessed by themselves or by their care providers. Beyond data protection, the Act is intended to lay the foundation for the health sector to benefit from AI innovation, improving patient care, system efficiency, and creating economic opportunity for Canadian companies. Why does this matter for physios? As you engage with digital tools and AI in your practice, this legislation is working in the background to ensure those systems are trustworthy, interoperable, and held to a national standard. It's the infrastructure that makes safe and confident participation possible. 1 month later, so in March, at the provincial level, the Ontario government announced it will source and offer a single province-wide primary care medical record system, supporting the Primary Care Action Plan's goal of connecting every Ontarian to an interprofessional primary care team by 2029. The aim is to integrate patient records, reduce paperwork, and improve the quality of care. So why does this matter for us? As more of us join interprofessional primary care teams, physiotherapy will be increasingly integrated into provincial digital infrastructure. That means we are in a growing position to benefit from these public investments and to be more meaningfully connected within the broader health system. A related and exciting development that I think many of us are using is the rise of AI scribes. You are going to hear about that later on in the webinar as well. About 30% of family doctors are already using them regularly. And an initial study of 150 primary care providers found that physicians reported spending 70 to 90% less time on paperwork. We know administrative burden is a real issue for physiotherapists too, regardless of our settings. As AI scribes become more embedded in primary care, all team members, including physiotherapists, will increasingly have access to these tools to support better patient care and a better provider experience. And importantly, Ontario has a vetting and approval process for AI scribes so physiotherapists can participate with confidence that privacy and regulatory requirements are met. As the province continues to invest in digital health infrastructure and as physiotherapists become more embedded in primary care teams, the opportunities to participate in new and integrated ways will only grow. And as we work toward the implementation and operationalization of expanded scope, it will be critical that physiotherapists have access to digital systems that align with Ministry of Health infrastructure, including repositories for diagnostic imaging and lab results. And before I pass it over to Craig and Mary Catherine, I want to look ahead. It is clear that AI is not a distant concept for our profession. It's already here and it's reshaping physiotherapy across 3 interconnected areas that I want to touch on briefly. The first area is education. AI is changing what it means to be a competent physiotherapist. Our university programs need to and are evolving to reflect this new reality. Students entering the field today will practice in environments where AI-assisted tools are part of everyday clinical work. That means we need to be intentional about what new competencies we are building. Things like digital health literacy, critical appraisal of AI-generated outputs, and understanding the ethical dimensions of using these tools with patients. The expectations on new graduates are shifting, and education has to lead that change. The second area is in the workplace. Physiotherapists are increasingly being asked to adopt new AI-powered tools, whether that's for documentation, movement analysis, outcome tracking, or clinical decision support. And it's not just coming from employers. Patients are arriving with their own expectations. Many of them have already used AI tools to research their condition, interpret their symptoms, or explore treatment options before they even walk through your door. As physiotherapists, we need to be prepared to meet patients where they are and to think critically about which tools are actually adding value to the care. And that brings me to the third area, and perhaps the most important message on this slide. You are not navigating this alone. The OPA recognizes that keeping up with the rapid AI development is a real challenge for practicing clinicians. Professional development and training in AI is a priority for us. We are committed to being a resource and a partner for our members as the landscape continues to evolve. We're here to help you build confidence. We're here to help you access credible information. And we are here to engage with these changes in a way that keeps patient care at the very center. Physiotherapists in practice may be navigating that digital divide, but OPA is in this with you, and we're here every step of the way.
Hello, everyone, and thank you, Charlotte, for kicking us off today. Uh, we're here today to give a little bit of an introduction to some of the work that's been going on at the college to help physiotherapists as they look to integrate AI into their practice in a responsible way that protects their patients, privacy, and professional judgment. So we've already been introduced. I'm Craig Roxborough, Registrar and CEO. I'm with Mary Catherine Fraser-Saxena, who's our a PT and a manager of our practice advice. We want to thank the OPA for starting us off right today with the territorial acknowledgement and signaling that we all have a important role to play in reconciliation. I'm sharing with you that I'm coming from Etobicoke today, which is a name for my community that stems from the Mississaugas of the Credit word for the place where the alders grow. So I want to start at a high level and just signal sort of the college's broader attitude or approach to AI in healthcare with just a phrase, optimism with caution. It would be, I think, strange for a regulator not to add caution. Regulators are, by definition, sort of cautious and thoughtful, attuned to the risks that exist as things change and as care is being provided. But at the same time, in this particular context, we recognize that there are many benefits that can come from the use of AI as a tool in practice. There's opportunities for it to improve your lives as clinicians, opportunities for it to improve the patient experience, ways for us to have efficiencies in the delivery of healthcare and the way that you manage your practice. But at the same time, there are risks or challenges as this tool gets adopted that need to be managed appropriately to ensure that it's a safe, reliable tool for practice. So while we are optimistic with a little bit of caution, we also like to zero in on the fact that AI is a tool. We're not viewing AI as a replacement to you as the professional. It is a tool that supports and helps you as a professional. Fundamentally, at the end of the day, you are the one that has the professional and clinical judgment that is needed. You are responsible and accountable for the care that you are providing, but AI can help support you in the delivery of that care. But AI is not a physiotherapist. It is just a tool for you to use in your practice. Building on what Charlotte was saying, we know that this is a space where the profession has been looking for advice, support, and guidance. At a OPA interaction event a couple of years ago, there was a specific call out for the college to publish some information about AI, and we responded with a very early blog, just acknowledging the reality of AI as an emerging tool and signaling to you what some key considerations or risks that you need to have in mind as you integrate it into your practice. About a year or so later, we came out with a guidance document called Artificial Intelligence, Principles for Physiotherapists, and we paired the release of that guidance document with a couple of blogs, including a practical application of these principles to practice in relation to using scribes. Across all of this discourse to date, we really have zeroed in on the reality that AI has not fundamentally changed or altered your expectations, but rather expectations that apply to you the expectations that already apply to you just need to be applied in this domain as you're using the tool. So you are still responsible for appropriate assessment, diagnosis, and treatment. Your decisions still need to be evidence informed. You have expectations around documentation to ensure that your clinical notes are comprehensive and supportive of understanding what care has been provided. You have obligations and responsibilities to communicate with patients in a clear, transparent, and patient-centered manner. You have legal requirements through PHIPAA to ensure that patient information is secure and private and managed appropriately. And there are commitments that you need to abide by that are set out in the Code of Ethical Conduct. And really what we've been trying to do is to zero in on the reality that these expectations just need to be applied to this tool rather than this tool creating new expectations for you. So to help support you in how you apply these expectations to the use of AI, we came up with a mnemonic device using the word trust. Trust is sort of the cornerstone of a good physiotherapist-patient relationship. So we zeroed in on that word and articulated how you can use AI in your practice in a way that helps to build and support that trust. So in terms of the T, we've zeroed in on transparency and consent. So as you integrate AI into your practice, really be open with patients about when and how AI is being used in their care, and obtain informed consent for the use of overt uses of AI in the way that you're delivering care. As MC will speak to shortly, patients really have an expectation that they understand how their personal health information is being used, and really are concerned about how AI is impacting their care. The R stands for responsibility, which just zeroes in on the reality that you, as the practicing clinician, are accountable for all clinical decisions that are being made, even when AI supports or informs the decisions that you've made. These could be straight clinical decisions around assessment, diagnosis, or treatment, or it could be clinical decisions that are made around what goes into the patient's record. You are fundamentally accountable for all of the results that are produced by AI in these spaces. For understanding, we really want to draw your attention to the fact that AI is not a perfect tool. AI is only as good as the data that it is trained on. We know that the data that it is trained on often reflects or encodes bias. We also know that the data that it's trained on may not be representative of all the populations that you're treating or the specific conditions that you're seeing in practice. And so as you rely on AI to support your work, you need to be aware of and understand that these biases and limitations may show up in the outputs. And so as you work with AI, you need to be aware of those limitations in terms of the decisions that you're making. On the security side, you as a practicing professional have obligations to protect patient data and privacy when using AI tools, just like you would for any other tool or any other way that you are collecting information in your practice. And so we really want to signal to you that as you use AI, you need to ensure compliance with PHIPAA and other privacy regulations that may apply to you. And then lastly, we wanted to signal to you that AI and the use of AI in practice really does require some competence or proficiency on the part of the user. Just like when EMRs came online a number of years ago, you needed to learn how to use those EMRs in order to have it support your practice. The same is true as AI is coming on now. The outputs that are generated from AI are only as good as the prompts that are going in. And you have a responsibility to have some competency or proficiency in these tools if you are using them in practice.
Thanks, Craig. So we thought it would be helpful to share the feedback from the Citizen Advisory Group report regarding artificial intelligence. So for those who may not be familiar, the Citizen Advisory Group brings patient and caregiver voices and perspectives to the healthcare regulators in Ontario. And in the fall of 2024, they provided a report called The Expectations of Healthcare Provider Use and Artificial Intelligence. So across all of the feedback from the citizen advisory group, the patients and their caregivers communicated that they want to be able to trust their healthcare providers. And some of the guidance from the report includes that AI should support the care, but never replace human judgment. So members of the group were generally open to including AI in their healthcare, but they emphasize that it should really be assisting clinicians and not making decisions on its own. And maintaining the idea of a human in the loop was seen as essential as an essential part of safety and trust. Also, allowing the patient to decide whether to have an AI involved in their healthcare appointment was seen as an important part of building that trust. Patients want transparency when AI is involved, and they want to know what aspects of it what aspects of their care are involved with AI, especially in things like diagnosis and documentation and decision making. So clear explanations in plain language are needed so patients can understand what AI is doing and what its limits are. If you are using AI to help with differential diagnosis, for example, bring the patient along in your thought processes of how you reviewed the AI response and whether you agree or disagree with it and why. And then finally, we've heard lots about trust so far today. This trust depends on what the safeguards are around privacy and accountability. Strong concerns around the use of people's data, potential bias in AI systems, and privacy were expressed by the group. And they also expected us as regulators to provide some clear rules and oversight as the AI becomes more widely adopted in physiotherapy care. And an overarching principle that was shared was that the technology can never outpace the trust involved. So my role as a practice advisor, I get to hear directly from you as a group. And I thought I would share, it might be interesting for you to hear kind of what your colleagues and what the profession and patients are asking us as practice advisors. So as you've heard a few times before, trust is a key part of successful implementation of the use of AI in your clinical practice. And building trust requires time. You need to create space for patients to connect with you, and you want to encourage patients to ask questions and to not assume that patients understand what you mean by including AI in the appointments with you. So most of the inquiries that we've had in the practice advice team relate to the use and uptake of AI scribes, as we've heard before, specifically about how to obtain consent, how to know if the software meets the privacy requirements of PHIPAA, and whether the college approves or endorses certain programs. Spoiler alert, we do not approve or endorse specific programs. But I think an important practical aspect of getting consent from patients about the use of AI in their care is to understand it yourself. Can you explain AI in plain language terminology? You should know how the scribe program works and be able to explain it very plainly, answer any questions about how the program listens during the appointment, and, for example, what happens to the recording of the transcriptions. If a patient chooses to not engage with AI in the appointment, you should have an alternate method of charting at your disposal for their appointment. So know how to turn off the scribe if you need to. Consider if you're able to explain the value that the use of the AI tool is bringing to the appointment. So, for example, if using that scribe provides you with more time to spend with the patient, you can share that expected outcome with them. You should also be able to explain the risks such as bias or error and how you plan to mitigate for those. With regards to privacy, you're going to want to check with the description of the software and the developer that it meets pre-HIPAA rules. Some of the programs that are developed in the US, you will be able to read in their description that they are HIPAA compliant, but this doesn't automatically mean that they are PHIPAA compliant. Charlotte alluded earlier to an Ontario-specific repository or list of programs that do meet the rules. So maybe we'll get Charlotte to share that in the chat for everybody. How the software deals with the recordings of the interaction may affect the privacy compliancy of the program here in Ontario. And the Information and Privacy Commissioner has guidance for you if you're a health information custodian that you would apply if you're considering implementing the use of these AI scribe programs. And we can link that for you in the chat after we've finished our presentations. One of the things you may find now is that AI technology is in your emails. So Gmail, for example, has some AI-enabled features, and safeguarding the personal health information of your patients would include considerations around communicating with them via email and how those emails are protected. So either your custodian will have guidance for you about how you're going to communicate with email, and if you are the custodian, be sure to consider how sending and receiving personal health information through email and whether or not you have to consider that there's an AI-enabled aspect of the mail service. And then finally, we're hearing lots of anecdotes about how using AI to help with charting can be an enormous plus to having increased patient contact time, as well as less charting time, which improves the physio's work-life balance for sure. But be sure to set aside time to review the notes for accuracy. The documentation standard applies, whether the notes are handwritten by you or they are generated by the AI scribe. Last but not least, if you have questions, if you have a new approach or a new concern about AI in your practice, be sure to reach out to us on practice advice. We're happy to help. And if we don't know the answers, we can help you find a smarter person who knows the answers. Thanks so much.
Okay, and now for the last chapter of today's presentation. There we go. So thank you so much, Charlotte, Craig, and Mary Catherine for setting the stage. And thank you to OPA for inviting me. I'm Anna Marie Sneath, the Senior Director of Ontario's Arthritis Rehabilitation and Education Program, to give you a little bit of insight into the journey we had adopting AI Scribe over the past year. And just to set a bit of context for you, if you don't know already, the Arthritis Rehab and Education Program, also known as AREP, is a ministry-funded program for all of Ontario. We have 13 offices in the cities you see here, but we also partner with over 125 other healthcare organizations in order to have space to deliver our programs further into adjacent communities. We have 50 staff, 40 PTs and OTs, 4 social workers, and 8 virtual front desk staff. And it is a chronic disease self-management program. It's very easy to access us. If you take down this phone number, clients can self-refer. We certainly accept referrals, but it's very easy for them to self-refer. All they need is an OHIP number and a confirmed or presumed diagnosis of some type of arthritis, and we see it all. So what was our reason for action? Well, I think in society, AI is just everywhere, personal life, work life. And I had staff that were already trying to experiment with a lot of free versions. There's so many startups and vendors out there. And quite frankly, we've already heard that documentation time is the one thing that I find that keeps staff late more than anything else. So there is a documentation burden in our work. And then at the same time, I also received a request for a work accommodation from someone with a significant upper extremity injury to use AI Scribe. So the time was ripe. We had the interest and we thought, we've got to dive into this now. It's everywhere. What are we talking about? What is AI Scribe? Well, essentially, it's a digital platform that listens to a conversation or a dialogue between the healthcare provider and the patient and transcribes it into a document. It is not a recording of the conversation, it's a transcription. Because of that, it is meant to decrease documentation time by eliminating the manual input of documentation. This will enhance or decrease the clinician's cognitive load because you're not concentrating on entering the data. Your presence and your focus is on the person in front of you that you're looking after. And in follow-up to that, the patient experience is meant to be better because they appreciate and feel this increased presence you have with them. So this requires a very methodical approach. This is new. There's new lexicology out there. Yeah, things like large language models and predictive AI and generative AI. This is all new ground for many of us, and learning about it and finding out about it is important. Peers are a great source of help. We have peers that are really, tech savvy and interested in this area. And there's lots and lots of other sources to learn from. I've mentioned two here that are good. TCARM is the Temerity AI in Research and Education and Medicine division, and they have a ton of good resources on their website, learning, education, research, and then Embody, of course, has a lot of other things, but they're not the only ones. The point is to get out there and learn about it a bit more, and that's where we started. Then we looked at obviously the legislative and regulatory requirements, so diving in to see what the colleges were saying, PT, OT, social work, and the guidance that they've provided. In the world of rheumatology, we also had the Canadian and the Ontario Rheumatology Associations that were starting pilot projects of their own to really look at AI scribes and how they worked with current EMRs and which ones were the most value and useful. And the Information and Privacy Commission of Ontario has a lot of good guidance. So taking this all together, it really gives you a sense of what you need to build into your program if you're going to adopt it. And then, of course, technically, we had the help of our in-house IT department. I was also able to get in touch with a medical informatics specialist at Halton Healthcare. And, as a lot of things are in this world, they're designed around physicians. And one of the interesting talks I had with Halton was influencing them on the importance of, if you're going to set it up for your physicians, there's a whole world of rehab practitioners that would also benefit from it. And he, really found that valuable. And so, with all the work we did in our environment, we came up with three different vendors to look at: Heidi, Scribeberry, and Tally. And I've also put up here the Ontario MD website, which is a subsidiary of the OMA, funded by Ontario Health. And it's really a procurement site that vets the vendors so that you are getting a quality product with cost and value as part of it. Now, one of the interesting pieces here is that to get on that list, you have to be Canadian in your development. And Heidi is Australian. So I'm going to talk a bit more about that as we go forward. So last year in April, I'd say through to the summer, we did the research as I've just described. And then starting in August through into the fall, we got leadership support and a budget verification. And I'm just going to throw out there as a ballpark, you should really be considering this is another platform you have to pay for. And it's probably in the range of about $1,000 a year per practitioner. Now, there's always negotiations to be had and full-time and part-time equivalents and so on. But if you're looking to budget, that's what you have to look at. We had a dedicated practice lead put towards this and quickly created a working group of early adopters, people that were really interested in this stuff. And we included our senior director of IT to help guide us. We chose 3 vendors and decided to pilot each for a month. And before we met with the vendors, we sent them out a survey of questions so that we could gather the information quickly and be ready to discuss things in a more proactive way. So you can ask for things like their privacy platforms, their digital and technical issues, their responsiveness, their resources. And then we were ready to make a decision. After we'd run the pilots, we did collect data pre and post. I guess work efficiency and time studies were very important, as well as user experiences. And we ended up choosing Heidi, which I said is not created in Canada, but it hands down met all of our needs with good responsiveness, good support, and we've entered into a 1-year contract with them. Redesigning some of our policies and procedures, as the college mentioned, just to include AI as a piece of everything that we're already responsible for, with consent, with documentation, privacy, and ethics. For instance, you need to show that you're getting consent on all of our AI generated documents each and every time you're using AI. It's very important that clients understand when they're interacting with AI and when they're not. And on anything that we produce, we've got a line at the bottom of it saying that it was generated through the use of AI. We then developed champions within the pilot group to act as supports for the rest of the staff. And we curated some resources so that some pre-learning could happen before we came to rollout. And that's, again, just to make people aware of what AI is, some of the language around it, some of the ways it operates. And then January, February, we were in a position to support a rollout where we had designed already some templates for staff to use. We had vendor training, but what was really key was our own in-house training with our staff that could integrate the AI procedures into our workflows. We set up drop-in sessions along the way so that the champions were available to answer, troubleshoot, problem solve issues as they came up. We created a community of practice on Teams for the same purpose, and we continue to monitor and evaluate. Some of the results we have was that after the pilot, now that was only with about 8 or 9 people, there was an average decrease in documentation time by 38%. This was significant, and the pilot group were in complete consensus as to wanting to move forward with this for the whole program. Surprisingly, almost all clients consented, and we developed a quick and easy script using plain language that clinicians could, cut out or put beside their workstations to have to refer to in order to how to describe this to clients. And then when we finished the pilot and had to decide about implementing AI into our workflows, I chose not to make it mandatory because it is a tool like anything else. And so surprisingly, I had thought that several people would not want it, but almost all staff did want it. So we did proceed under that with those numbers. And now that we've been beyond the pilot and 3 months or so running, there is still a lot of optimism about the use of this tool to improve our documentation time and experience in our workflows. However, we've found that we need to have a hybrid approach. Now, yes, you need to have a backup because if you lose power, if you lose internet, if people don't consent, you can't use it. So you have to have other methods or usual methods to chart by. But we've also found that because of the way it operates and the way physiotherapists assess people, it is most suited for the subjective and history-taking piece of the assessment. It is not as useful for the physical assessment. And part of that is because the output is in a narrative form, and physiotherapists often use diagrams, charts, and tick boxes. And at this point in time, the scribes are not keeping up with that. There is one company that produced a homunculus, which in rheumatology we use, and it was just very clunky and full of inaccuracies. But no doubt in the future, I'm sure we will get to that point. We've adapted our chart audits to include AI elements. And this is a picture of Laura, one of our more experienced therapists who wanted to share her story. And she was someone who reluctantly wanted to try this. And on day 1, by noon, she said she knew this was a game changer for her. By her own explanation, she identifies herself as someone who's not very tech savvy, who types slow and makes a lot of mistakes. And what she found was that by using AI, she was faster, she was more accurate, and she felt she was able to spend more time with clients and ultimately could see that she might be able to see more people in a day because of it. So that's just one story, but an interesting one. Now, AI scribe is not perfect. It's far from perfect. First of all, it requires change behavior in how you present yourself when you're using it. Sometimes you have to articulate things that you never would have before. For instance, if you are measuring shoulder range of motion, you have to say the right shoulder flexion is measured at 95 degrees range of motion. Now, we don't often talk like that, but you have to do that in order for this program to capture the right information. It's full of bias. Another example is if you identify someone's occupation as nurse, it automatically assumes it's female. It makes assumptions. One time, when it identified a female client who had come in with a male attending the appointment, it automatically assumed it was a husband and wife, and it was actually a mother and son. We've already talked about the narrative report format and how it's not suitable for all elements of the assessment. And there's also been mention already about the upfront time to train with prompts. The output is only as good as the input, and the AI scribe can learn, but you have to spend time allowing it to learn by prompting it to do certain things, and it does over time get better. And lastly, you must edit, edit, edit for accuracy. But it's a whole lot easier to edit a printed document than to manually enter it. And sometimes clinicians are finding that it remembers a little bit more detail than what they actually remembered. So potentially can be more accurate. So for the future, we need to scrutinize and stay curious. Most of these systems have been developed with physicians in mind. And I think as rehab professionals, it's really important to get our voices in there, work with vendors, look for opportunities for them to better integrate with our systems, getting them to embed charts and diagrams, better integrate with EMR systems. Although some of them do say they integrate, what they integrate is so small at this point, it doesn't really end up being an integration. But again, in the future, I see that this will move forward. We will maintain our working group as we have plans to continue to evaluate if we're going down the right track. We're going to do a year-end evaluation and determine, if we stay with the same vendor, if we move on, if we make any changes. We're going to run a client survey in the fall so that we can really dive into the client experience and make sure we understand how it's working for them. And lastly, I can't emphasize enough connecting with each other and our peers. I think you will have the great opportunity of listening to a home care therapist from Durham in the second session. They are also using a scribe, the same version as us, and I'm in touch with them. We want to bring our staffs together to learn from and with each other, because I think we have a lot to gain in that regard. And so here is my contact information. If anyone would like more information or wants to talk about your experiences, I'm very happy and open to make those connections. So thank you very much. And a special thank you to my little baby Renata. Thank you for listening to Nanny today, and I look forward to when you can teach me more about digital stuff. Thank you.
That's wonderful. Thank you. Thank you so much to all of our presenters. What great information. And we have some questions that have come in, so we will work through those. Just a reminder for all of our attendees, please do put your questions in the chat. And we will work from there. So we have a few sort of themes, I would say, that are coming through in our questions, which is always nice to see because I think everyone's thinking along the same lines. But one of the big questions is really around the vendors and what are some of the things that we need to keep in mind when interacting with the tool. So I just want to say that Mary Catherine had alluded to to this list that Charlotte had mentioned, which is a vendor of record list. It is a ministry website. And as was mentioned, these are all vendors that have already been approved. So basically, they've already done the work on these. So we will share that list with you, that website. But I see there's also a question about, well, what about something like Jane? What about something like a physio platform, an EMR that some of you may be using where there may be a scribe that's been introduced. So I wonder maybe, Mary Catherine, I could pass it over to you if someone's sort of looking to, a scribe that might not necessarily be on that approved list, but they might be looking to use. What are some considerations they might keep in mind?
Yeah, it's a great question. I think that the key piece is going to be that piece that it is PHIPAA compliant around the privacy piece. And so Jane does a lot of work with a lot of physios around the province and outside of the province across the country. They're very accessible from my understanding. So when you have questions about their compliancy and or questions about the kind of the back end of things, you can reach out directly to them about that.
Perfect. Now, maybe Mary Catherine will keep you on the line here because we have a few that have come through also in terms of patient consent. So if you get a client consent during the initial assessment, do you need to continue to get consent for use of the scribe for follow-up visits?
So from a college point of view, consent is a conversation. And I heard recently consent described in the way that you don't just obtain consent, but you maintain consent throughout the interactions with your patients. So absolutely, you can have a conversation at the beginning. That's that important piece about, do you know how to describe AI? Can you describe it, simply and effectively to patients? Answer their questions, provide them with the risks, the benefits, the alternatives, the option to not include it. And then if someone has said to you, I'm not comfortable working with having AI as part of our interaction today, you can make a note of that in the chart. You don't have to ask them every single time if they've changed their mind or not. But certainly if you are planning on using AI, you've already had that conversation. The next time you could say, as a reminder, we would be using AI again. Do you have any questions about that? Is that still okay with you? Has anything come up for you? Because people, just as we're learning, patients are learning. So in the span of, one appointment to the next, maybe they've read something that's given them pause or concern. So yeah, absolutely, it should be maintained and just it's a touch point every time.
Maybe I could just add to that, Emily, that in real time, it can be very dynamic within the same appointment, and AI can be turned off, it can be turned on. And we had an instance where with one client, they started off and then we turned it off halfway through on request, and that is possible as well.
That's a great point. We have another question here specifically around AI-generated exercise programs. And would there be any sort of different elements to consider if we're speaking more about an exercise program versus, say, using a scribe?
Well, if the patient is independently accessing an AI-generated exercise program, that's their choice. They are autonomous to make that decision. We would respect that decision. It wouldn't be considered part of their physiotherapy care necessarily. If you're using an AI-assisted exercise prescription program, the onus is on you as the physio to ensure that it is safe and appropriate care for that patient. So it's the same, it's a tool. So it would be the same as if you were using another exercise program that maybe it had kind of a protocol or a pre-programmed list of exercises. You're going to check that against what your patient's goals are and what your findings are to make sure that it's safe and appropriate to prescribe to them.
Great. Now, in a similar vein, how do we protect the public with potentially false AI material online? So what if patients are coming to us, they've found this information? What are the tips in terms of managing that situation?
I mean, that's a huge consideration, and it's a huge issue outside of AI as well, just being on social media and listening to some of the information that's being shared by non-healthcare providers and non-evidence informed practitioners. That's a constant conversation that we have to have with our patients. And I think it's very similar, whether it's AI generated or whether it's influencer generation, where, handling misinformation and addressing misinformation an important part of patient care these days, I'm afraid.
For sure.
And if I can just add, I think this is a real opportunity for the profession to, build that connection with your patients, to be that reliable source of truth and advice and guidance, and to help them navigate a very difficult and murky space. This is a bigger version of the Dr. Google worry that we had from years ago. So it's just a matter of, you being that confident, reliable source to help build that trust and use the relationship that you have in order to guide them through it.
So in terms of the actual use of the AI scribe, Anna Marie, this might be best for you. It's a question about, can you use a scribe to make notes and then copy and paste it into an EMR? So maybe could you just talk a little bit about how your scribe interfaced with your EMR and how you connected those things together?
Yeah, sure. That's exactly how you do it. Unless it's integrated, and most systems are not, it is a question of cutting and pasting. But again, you have to edit it thoroughly. And when you're happy with it, you just cut and paste it into your EMR.
Super. Now, in terms of, we're going to go back to consent a little bit here. So this is just to clarify, Anna Marie, in terms of, do we need to have written or signed consent, or is verbal consent enough? And then in documentation, does there need to be an explicit phrase that AI is being used in capturing the information?
We've done both. We've chosen to do both. We've chosen to document it for the reasons of making it explicit. So why not? Like, why question it? Make it explicit. It's a tick box, and the consent is there. We've also chosen to make it explicit that the report was generated with AI, and we put it in our template. So everything is clear, it's transparent. It just protects everybody going forward and sets common understanding.
Great, thank you. We have another question here, which I can imagine probably is, several clinicians may be in this position where you may be running a clinic. There's obviously increasing operating costs. Some of you are working within funding models where there haven't been increases in a lot of years. So just really trying to keep up with some of these technology developments can be really challenging from a financial perspective. So maybe I'll just sort of open the floor to the group. If there's any thoughts or insights, how do we as a profession really tackle this? Because it seems that, we've seen that there's been a lot of investment in terms of supporting physicians, in terms of the uptake of AI scribes. About 30% of physicians now in Ontario are using the scribe. Are there opportunities for us here as a profession? Maybe Charlotte, I'll pass this over to you for your thoughts to get us going.
And I will wear my OPA president's hat right now. I am in private practice, and we have adopted it at our clinics, AI Scribe, widely, and have worked together to Anna Marie's point within the clinic to understand how to use it effectively and efficiently, and how to financially operationalize it to make sure it's within our financial constraints. I do think, and now my OPA hat's on, is that we are at the tables for these conversations. We are at the tables for making sure, the interdisciplinary component, the primary care component, that we are all speaking the same language to some extent, and we are integrated based on our scope, our needs, and the effectiveness and efficiency of treating the patient, the client, the person in front of us. And I think Craig said it, maybe Mary Catherine said it, that this is a tool, and a tool that needs to benefit our practice, benefit on what we're doing, and benefit the patients in front of us. And so as a profession, whether we're in the public sector or the private sector, I can speak to the universities. We're integrating into curriculum. We're integrating it into how we are teaching, so that we are speaking the language, we are up to speed on what is happening, and we are at the tables as the AI conversations continue to move at unbelievable speed, but we don't have anything set in stone yet. And I'm sure my fellow panelists can comment as well, so I'll allow them to unmute. But as a profession, as the OPA, we are there. I mean, this webinar is speaking to that, and we are looking at how do we make sure that the AI component, whether it's AI scribe or tools or home exercise programs, across the environment, across the populations we treat, across the demographics, there is a consistency while allowing for flexibility, adaptation, and evolution as we continue to be on the AI train, but we're not at our final destination yet either. Hannah Marie, I don't know if you unmuted, but I'll pass it to you.
Yeah, I was just thinking, in terms of advocacy and support and government speak, it's about dollars and maybe access to care. And if we can translate what we're doing into those terms when we advocate for funding, for support, I think it's very important. And so time studies with what you do, showing efficiencies, can you see more patients? Can you provide more access to care? Those are all, I think, important things to speak to. As well, there are, and I know Jessica Powers knows some of this, and she's going to be in webinar too, but there are funding opportunities out there. Start looking because she found something. And I mean, those are few and far between, but I think those both arms are important in terms of trying to get support for this.
Thank you.
If I could just add, I think this has been very quick for the technology to pop up and for it to go from emerging to beginning to be embedded. But it also still feels like we're on the early days. So given how much investment has been made into, say, the medical space, and we're at, I think, Emily, you said 30% of doctors have it. There was a lot of investment to get to 30. So we still have, I think, a long runway for this to become normalized, socialized, and a part of our standard operating set. In the same way that when EMRs showed up, there's an initial uptake, and then there's a pause, and then there's another push, and then next thing you know, I don't know, most people probably can't even fathom operating without an EMR now. So it's an exciting time, but we still have time to make all of the progress.
Thank you, Craig. I know we're getting close to the end, and I just want to say we so appreciate all of the questions in the chat and really see that this is really just the beginning of a conversation. As we mentioned, we see that the AI journey is going to be a long one for all of us. So just to say, if we don't get to your question today, we are going to take these away to help formulate how we can better support you moving forward. So, but we do have time. I'm going to just land on one that I think maybe a lot of people might be asking, and this is probably going to go to the college. What are the rules and policies around manually documenting in an AI platform, such as ChatGPT, Claude, or Copilot, if you ensure that privacy and confidentiality is maintained? So just in terms of what's the caution in terms of using some of those general AI platforms for documentation?
I can maybe start, Craig, if you want to fill in as well, but there are certainly risks to privacy when you're using a large language model without safeguards on it, like some of those bigger ones like Claude or ChatGPT. If there's anything identifiable in the information that you've included, you are risking the privacy of your patient's personal health information. Your custodian will have rules for you around that, and if you are the custodian, you should develop rules around that for the agents who are working for you and handling the personal health information of your patients. The Information and Privacy Commissioner, again, has further details around that. That is who manages and implements PHIPAA, and so they have the specific rules around that for you. But I would caution anybody from using the large language models with any kind of charting specific stories, anything that could be identifiable, because that would be seen as a risk.
Yeah, just your privacy obligations are your privacy obligations. We're not here to vet each particular tool. You have to be satisfied that those tools that you're using are meeting and fulfilling your privacy obligations. But as many of the panelists have already noted, there are vendors of record, there are pre-approved tools that are out there, or there are other tools that aren't on the vendor of record that would readily be able to provide you evidence and confirmation that they are meeting your security and privacy obligations. So that is the number one consideration, regardless of the platform or the tool that you are using.
Great. Well, we have gotten to 1 o'clock. I just want to extend a really sincere thanks to all of our presenters today. What a great, rich conversation. And I really want to thank all of our attendees as well. Thank you for your thoughtful questions and engagement. We do hope that you'll join us next week for part 2, where you will hear more from physiotherapists who are integrating AI with their practice. And please do stay tuned for an email that will have the recording to this webinar, as well as a survey where we'd love to get your feedback. So thank you all very much for joining us today. Take care.